My name is Paul Sinclair. I'm a community pharmacist from Sydney, Australia, and I'm president of FIP. I've been engaged with FIP for the past 14 or 15 years and previously have been president of the community pharmacy section, chair of the Board of Pharmaceutical Practice, a bureau member, and now president. I have owned community pharmacy in Sydney for more than the past 30 years. FIP, or the International Pharmaceutical Federation, was founded in 1912 and is headquartered in The Hague in the Netherlands. It represents more than 4 million pharmacists, pharmaceutical scientists, and pharmaceutical educators from around the world by way of our membership of member organisations, which is currently over 150. FIP is in fact the global organisation representing the pharmacy profession in all its disciplines. We believe that life course immunisation is critical to achieving best possible health outcomes for our communities. The WHO says that a life course approach to vaccination, expanding or developing new delivery platforms, will provide opportunities for immunisation services to be integrated with other health programs. This has the potential to provide a more people-centred approach to health across each stage of life. Life course vaccination is critical to healthy ageing. There are 4 vaccine-preventable respiratory diseases: COVID, influenza, pneumococcal, and RSV. Pharmacists are uniquely positioned within the primary healthcare space to improve vaccination rates within our communities. Pharmacists are trusted, accessible, and professional, and can help in improving health literacy rates within our communities. FIP has a strong advocacy agenda to promote pharmacist-delivered vaccinations. We saw clearly during the COVID pandemic the impact that pharmacists trained to vaccinate can have on improving vaccination rates at a local, regional, and national level. FIP has developed for its member organisations a vast library of resources comprising reports, training, and toolkits to assist in the development and implementation of vaccination services within pharmacy. In the past 12 months, FIP has been engaged in a global campaign, Think Health, Think Pharmacy, designed to help policymakers and health bureaucrats understand that pharmacists are frontline primary healthcare providers and are well positioned to help in the delivery of vaccines within communities. Our FIP development goal number 16 is communicable diseases, and these in many cases are preventable by adherence to a vaccine schedule. Recent years have seen pharmacists' roles in immunisation evolve significantly, with increased access to administer vaccines across regions. Based on a cumulative data set of 120 countries, a 2024 FIP report leveraging pharmacy to deliver life course vaccination evaluates many aspects of pharmacist-led vaccination. These include advocacy activities, regulatory frameworks, vaccination administration, and prescribing, training, certification, access to vaccination records, remuneration models, and identifying barriers to extending these services. This study forms part of the Vaccination Surveillance Project, an ongoing initiative aimed at continuously monitoring and accessing the development of pharmacist roles in immunisation globally. Vaccination delivery by pharmacists has proven to be a valuable expansion of scope of practice. The first message to policymakers, healthcare professionals, and the public is think health, think pharmacy. We might also say think vaccination, think pharmacy. Life course vaccinations are important to healthy ageing and the prevention of many non-communicable diseases. Pharmacists are accessible, trusted, and professionals. They can educate against vaccine hesitancy, improve vaccination rates within communities, and encourage patients to maintain life course vaccination schedules. Pharmacists are a largely underutilised resource within the community, and we would urge policymakers and health bureaucrats to embrace the potential of pharmacists to do more and to provide more primary healthcare services, including, of course, vaccination by way of pharmacist-delivered vaccination. FIP has hosted 2 global vaccination summits in the last 12 months. The most recent of these were just in the last month in The Hague, where a number of our member organisations came together from across many nations to present case studies in vaccination delivery by pharmacists. It proved very useful in terms of the advocacy journey that many of these member organisations and countries have been through in order to deliver the regulatory change for pharmacists to vaccinate, and also to show that by way of expansion of those services, pharmacists in many countries are now delivering life course vaccinations, a full range of vaccinations from infant vaccinations through to pneumococcal vaccines and vaccines for shingles for the more senior members of our community. So the ability of pharmacists to contribute to the vaccination regime, and in particular to life course vaccination, is most important to acknowledge and to leverage.